Okay, guys, so I'm here today on the podcast, Physio and Fitness Podcast, with Glenn Robbins and Gemma Felstead. I'm very excited to have them on. We're going to talk all things running today. Glenn, you've met before on the first podcast. He's literally a regular these days. And Gemma is a running coach, and we're going to go into her background a little bit and also her expertise when it comes to running, which as I say, very excited about. Didn't actually tell you to this a minute ago, but I have actually started doing a bit of running myself. So maybe we'll talk about that a little bit. So I guess the first thing maybe to just discuss with both of you really is kind of what you think is the appeal. So what draws people into running? What do you think is the sort of mass appeal? Because obviously it's a lot of people do it. And maybe if we start with you, Glenn, and then we'll come on to Gemma afterwards.
I think there's a few reasons depending on the person, isn't there? So, I mean, one obvious one is the convenience. Yeah. So you put your running shoes on, you step out the door and you're away. So if you're someone with a young family, busy life, stressful job, it's very easy and convenient to just go for a run. So I think that's one. The other is then you've got your kind of running club runners. So then there's a whole social aspect to it. So it's like a solo sport that you do in a team, isn't it? So I think there's the camaraderie that comes with that and the social aspect. For me, what I notice with my runners is the mental health benefits that they get. So the runner's high is definitely a legitimate feeling, and I can vouch for that now because I've been running a lot more over these various lockdowns because it's a exercise that's much more accessible, and for de-stressing, improving your mood, getting a buzz. Basically, the running seems to be a very efficient way of doing that. So I think that's the main kind of draws for a lot of people: a bit of time away, a bit of time to themselves, or a bit of time with like-minded individuals and a bit of camaraderie. So you can get many things from it in the various environments that you can run.
Is there anything else? I mean, obviously that's a lot of the things that I would associate with it. But I don't know if you come into contact with patients or runners, Gemma, that have other things, or what do you generally tend to find with in your profession?
I agree with everything that Glenn said, really. It's obviously a very cheap sport as well to get into. You can just start with nothing, with just things that you've got. As long as you have a pair of trainers and something to go out running in, usually you can get on your way and get started. The other thing that comes into it a little bit now is things like the social media aspect of it. So I'm sure you've all heard of things like Strava or Garmin Connect or something. So even though it's an individual sport, we find that most runners are quite extrinsically motivated by others to do well and to improve. And that's often actually, which we'll come on to in a minute, why they are pushed to possibly do more than they need to, or to obviously leads to injury. But there's quite a lot of, even though you think it's a solo sport, there's quite a lot of motivation that comes extrinsically from your friends, your family, because it's very obvious now what you're doing when you run. Usually not many people actually run and keep it to themselves, which is great. I mean, we want to promote it, but I think that's another reason it comes into it, actually.
Yeah, it's really interesting actually, because my wife runs. That's her main thing that she does, and she's got Strava, and I started running, and I was actually the real opposite. I've got Map My Run, and I don't follow anyone. I do it because I want to know my times. I want to know what I'm doing. I want to sort of see progression, but I don't want other people to be able to see what I'm doing. I don't know. It's weird because I think you're right. A lot of people really like that, and they like the whole kind of like looking at and liking other people's stuff and looking at other people's stuff. But I was really opposite. But I guess obviously, like anything, you get very different mentalities. But yeah, it's interesting how many people I think love to look at, what that person done and like how quick are they doing and blah blah blah. But you mentioned
A lot of injured runners as well, while they're injured and recovering and getting back to it, they'll take themselves off of Strava. So when the times that they were getting before, they'll kind of have a hiatus from it until they get up to the level where they feel like they're performing to a point where they want to broadcast it as well. So a really interesting point there on.
I think we call that secret training, Glenn.
Which, to be fair, maybe that's an element of what I'm doing, because I don't want to, I feel like I don't want to necessarily post times that are not very good because I've only just started doing it. So perhaps that is, part of it. because I'm competitive, by nature. So maybe it is a bit of a secret training
We've made you think
syndrome.
about it
Yeah,
now.
yeah, exactly. Yeah, I love it.
Especially while your wife's beating all your times, you have
Yeah,
to,
exactly. Yeah, there's definitely competition there because I know what she's getting. But yeah, anyway. But yeah, then you mentioned, so I guess that leads us quite nicely onto the injury side of things, because we mentioned injuries a few times there. So let's just talk about a little bit about sort of common injuries you see, and also just why you think there are so many, injuries within the running as a sport.
Yeah, I think a lot of people are surprised at the injury rate, actually. So the injury rate in running is particularly high. So if you compare it to training in a gym, so if you just took someone that had taken up a new sport, and take two people, one goes and starts weight training in the gym and one starts running, the risk of injury from running as opposed to just gym training is 30 times higher. So it's a high injury rate. And if you look at injuries per 1,000 hours, there's more injuries in running than there is in football, for example, which is, again, surprising. When I was looking at the data, I could only really find ice hockey jumping out as being significantly higher. Yet you wouldn't associate the two, would you? Even sports like CrossFit and Olympic weightlifting have lower injury rates than running per 1,000 training hours. Now, obviously, the injuries you see are less dramatic and less traumatic a lot of the time with runners, but they are frequent nonetheless. So it's not without risk, So obviously the injuries you're going to see most commonly are lower limb, and the most common injury that you'll see in most MSK clinics will be around the knee. So knee injuries are more common in females as well. So if you get a female runner in, it's more likely to be a knee issue. In novice runners, you get a lot of shin-related pain. So MTSS, that's another common presentation. Achilles issues as well are reasonably common. And they tend to be a little bit more common in men. And foot pain, plantar fascia pain as well. So I think they're kind of your top sort of four. Just saw an interesting study actually showing that up to, I think it was almost 20% of runners. I'll link the study to the notes, but were suffering with back pain at any one time as well, which is, but they didn't relate it to their training, interestingly. So, back pain's fairly common in all walks of life, isn't it? So it's not less common in runners, it would seem. But yeah, it's predominantly lower limb, and they're the four kind of main areas that you would see in a standard sort of MSK clinic that was specializing in runners, I'd say.
And do you think, I think this is maybe a question for later, but I'll go into it now a bit about like running technique, and maybe if we bring Gemma in for this, but like how important do you think, running technique is? Do you think it sort of is something that is important for injuries and for general, and for obviously for performance as well?
Yeah, I think that's a really good question. There's kind of two questions there, isn't there? So if I was to only assess one or two things with any of my runners, the running analysis side of things and the retraining wouldn't be in the top two, So I think you're looking at, if you're looking at someone's injury risk, there's much more relevant stuff for most, So previous injury is a big one, running volume, spikes in running volume, recovery days. Yeah, so these are all the bigger players, I would say. And not everyone that comes into our running clinics will be retrained, if you like, and given cues. But the flip side to that, I think, is they should all have a running analysis. So I think if you're treating runners and you're specializing in that group, you should be looking at them run and filming them run and analyzing them run. It doesn't mean you're going to necessarily change it, but I think it's just good practice to have that as part of your overall assessment. And for some conditions, it is important, it is an important piece of the puzzle. So I do use running retraining. I do use running retraining cues with my injured runners, and certain conditions it's more relevant, and certain runners it's more relevant. But if you have someone in front of you that's running, 7 days a week, and they're only getting 5 hours sleep, and maybe they're carrying a bit of extra weight, and they've just had a knee injury 2 months before, whatever you do with them on the treadmill, you're going to struggle to get a good result if you're not addressing those other bigger factors,
And do you, Gemma, do you tend to, are you working, and we'll go on to sort of, the setup of the running clinic that you and Glenn both sort of share patients with, I guess, and the setup of it and how it works. So I think that's a really interesting thing that a lot of physios don't have, is that link to a really good coach and how the two things really combine to kind of give the optimal results for patients. But do you see many patients in the early phases when they are injured, or are you tending to sort of see patients on the other side of things where it's kind of like more that Glenn has seen them first and then you're seeing them more for performance benefits, if that makes sense?
It depends, actually. I can and have done assessing with them if they are an injured runner. I can still pick up on the things that need looking at there. I might then refer them back to Glenn if I think it's going to need more than some retraining from them. Going back to the running technique side of things, on the flip side, we sometimes see runners that have made a change to their technique where they didn't need to, and that actually leads them to becoming injured. So like Glenn said, you've got the big players that you want to address first, and lots of people think that they want to improve, get quicker, run further, without remembering that actually you need to be consistent. Consistency trumps everything. If you can be consistent, then you can always get better. But if you can't be consistent because you're injured or because you're tired or something like that, then it's very difficult to get better. So people try and change their technique over other things first. So we sometimes see runners that have done that. We ask them, is there anything they've changed recently? And they might say, oh, my friend said that I should start running more on my toes. And funnily enough, I've got an Achilles problem. So yeah, we see that as well, actually.
And do you sort of look at do you, and this I guess is thrown out to both of you, but would you look at things differently with an injured runner in terms of running technique? Would you think about things, I guess, differently with someone that was injured like versus someone that wasn't injured, looking at their technique, or would you look at them and assess them exactly the same?
So I think the assessment side of things would be similar, because we do a screening process. We look at the move, we look at the mobility and strength and muscle capacity around the hips, the quads, the Achilles, the calf. I think this is good to have us both on, because I wouldn't be working with non-injured athletes for just performance gains, so that I would send them straight across to Gemma for that. So I'm very much in a mindset, if they're running pain-free and it's not it's more of a risk to tinker with it on occasion, because you might end up causing them some issues later down the line. So I'm definitely not a running coach, so if someone comes to me and says, look, I want to knock 10 minutes off my time, can you give me some performance tips on my running style, then I would send them across to Gemma. But the process that we do and the steps that we go through would be very similar, I would argue, but the training program would be different. So the way that they would structure their training program, if we have a very definite switch from injured to non-injured, so in terms of capping so many runs per week and making sure they have certain recovery days and making sure they have so many strength and conditioning days, which be good to go on to. But when they're working more on performance, there's much more flexibility there,
Yeah, and I think that would be interesting to talk about later. But I think this is a good time to sort of introduce like the clinic and when why you set it up, and how it works in terms of assessing someone when they first come in. So obviously you've got this combined clinic. So why did you set up the running clinic and the screening service that you're doing?
It's kind of happened pretty organically over many years, really. So believe it or not, I'm not an endurance runner. I'm not a distance runner. I was based in London, and that's when I started getting an interest in runners. So I was working at a clinic where there was a high attendance of marathon runners in particular. So my background, strength and conditioning and working in gyms and stuff prior to being a physio. And I noticed that a lot of these runners had, weaknesses in certain areas, and they had issues when I was watching them and when I was screening them. And I started to develop a bit of a system for assessing them and identifying these problem areas and then kind of ticking them off one at a time. And at that stage, I didn't really have any input at all in their running program. So I just assessed them, I screened them, I came up with, you're a bit stiff here, you're a bit weak there, and structured their strength and conditioning, or in most cases, actually got them to do some strength and conditioning. And I started getting, decent results. So I was getting more referrals from various running clubs and friends and family of the runners that I was seeing. And eventually I got kind of labeled as the running guy. So I was seeing more and more runners in my list. And then I started taking more of an interest in the sport, because they're actually a real pleasure to treat. You'll never get a group of clients that are as kind of motivated and passionate about their sport. And it really is, great to work with runners, because they're motivated, they're compliant, they're committed. And then over the years, I sort of started to train in the actual analysis side of things and looking at the running. And eventually I took the approach of, for our recreational runners, our marathon runners, especially our first time marathon runners and stuff like that, that we should oversee their entire program. So started limiting their runs and structuring their plans and stuff. And the success rate went up exponentially then. So I think if you leave a runner, and especially an inexperienced runner, to manage their own program, they'll often download a program that's a bit inappropriate, maybe too advanced for them. And if they're doing well and recovering, they'll just keep running and running until they stir it up again. That's a really common kind of story. So I think if you can take over their whole journey, really, from assessing their problem to, dealing with their pain, educating them, and then structuring their strength and conditioning and their running program at the same time, it's obvious that your results are going to be better. And after I started doing that, it was really nice to get that reinforcement. I had 4 years where 100% of my London Marathon runners made it across the finish line, which was really, I was really satisfied with that as a confirmation, really, that it was a good way to go. And then people's goals kind of change, don't they? So when they first walk through the door, they've raised a lot of money for charities. It's a big emotional event for them, and their goal is just to make it across the finish line. And then as you start doing well and making progress and getting closer to the day, then the performance goals start coming back. So I want to get, sub 4 hours, sub 4.5 hours, sub 3.5 hours. And that's where we started to really link up more with Gemma. And Gemma's been on all of the courses that we've taught over the years, and she knows our system. And Gemma's a very sensible running coach, because some coaches are a bit ambitious with their clients as well, in terms of when they're coming back from injury, pushing them a bit more. We're all linked in together through various kind of groups, WhatsApp groups and stuff like that, so we can communicate really openly. And like Gemma was just a really good addition as well, in terms of getting people to perform better, getting their times better, and still, maintaining their progress so they're not getting re-injured.
Awesome. I think I want to just ask you one more bit, and then I think it'd be really good to come on to the more performance stuff, and we'll chat to Gemma mainly about that. So the last thing is, if you, so say you've got someone coming in and you've mentioned, that assessment, importance of assessment, and you've mentioned screening. So what's like a typical process? What's like the things that you're really looking out for? And for, I guess, for the physios listening out there, which I'm sure there'll be many, what would you advise them to do when they get a runner in their clinic, in terms of what things they should be looking for screening wise?
Yeah. So obviously you have to tailor your assessment to your individual, right? We all know that. But I think with runners, what we've developed is a system of screening that will cover a lot of the bases that you want to cover in that time, because sometimes it's a bit, and if you just go straight to the area, you'll miss some key points that might be contributing elsewhere. So I think the key thing, you want to watch them move. Yeah. So you want to look at them dynamically. So I look at the squat tests, the single leg squat tests. Sometimes we'll do hop tests as well and see how they're moving. And then when we're looking at mobility, we'll be looking at hip mobility. So there's a few key markers with runners that I think are really important. So looking at their hip extension, looking at the pattern around the knees, what their go-to movement pattern is when they're doing their single leg squat, for example. Looking at ankle mobility is a big one. Jack's test, looking at the big toe, what's the big toe mobility like? And then we do a series of capacity tests. So we want to look at glute max capacity test, glute med capacity test, calf capacity testing, so then we'll get them on the couch. We'll do like a Thomas. We do still use a Thomas test, although when we're looking at hip mobility, I'm more of a fan of more dynamic testing. So we do some hip mobility testing and standing as well. But the Thomas is a nice snapshot into, hip flexors and quads and IT band and stuff like that. And then at the end of that process, you have a bit of a list of areas that might direct your initial rehab program potentially. If they've got poor capacity on their glute testing or their calf, then it's obvious to include some exercises to strengthen that straight off the base, and they can relate that back to their assessment, so it makes sense to them. And then you want to get a diagnosis. So this is not just for runners, but any client that comes through the door, they want to know what the issue is, right? So by the time we've got them on the couch, then we'll do a thorough assessment of their knee or whatever the tissue is. Give them a diagnosis, give them a lot of education around that, talk to them about healing times and timescales related to that particular diagnosis, do whatever treatment you might want to do at that stage as well. Normally, if they're an injured runner, they come back. The second session is when we do the running analysis. If they're not in pain, there's no point doing that if they're in pain, because it'll be unreliable. But yeah, that first assessment really sets the scene, and I think we've kind of skipped over the key part there, which is your subjective, really. So you want a good 20 minutes if you've got that availability to take a history from them, previous history, their training volume, what have they changed. There's always some change. 80% of running injuries are overuse injuries, so they will have always spiked volume or intensity, or they would have had a layoff for whatever reason, and then they'd have gone back to a previous intensity. So it always comes down to some training load error, usually, in my experience, or unless they've gone over on their ankle or something. But so that's the kind of system that we have, and we go through it in a very structured way. But what's good about that is, we have specific runner assessment forms, and each clinician that's been trained up in that kind of system can relate to those, and we send them across to Gemma, and Gemma can see what their initial assessment was like, and we reassess that every 4 weeks or so and see if there's improvements there. And by the end of it, you should end up with someone that's maybe a bit more mobile if they had restrictions in certain joints, better muscle capacity, and then we'll work on strength markers as well, which again I think is unusual. A lot of runners won't like to train in the gym, but we very strongly recommend they do a bit of gym-based work for most of their injuries, and we'll give them body weight linked criteria to hit. So yeah, a few unique things there, I think, with the way that we operate across the running clinics, really. But it's quite logical when you break it down.
And then at what stage are you kind of coming in, Gemma? What are you? I mean, I guess it's very individual, because sometimes you might see them first and then maybe refer to Glenn. Sometimes you will see them and wouldn't refer to Glenn because they're not injured, so you're just working on performance. So how does it work from that transition between like Glenn and yourself in terms of when does performance take over in your view, and when do you kind of like when are you more involved in their rehab? I guess you're involved the whole time, right?
Yeah, I think the important thing to say is, even coming from Glenn's point of view, is runners are very scheduled. They like to do things in a certain way, and they like to hit, as Glenn mentioned, certain markers. So if you can relate to them or connect with them in that way and say, this is your injury and this is what I need you to do before you can get back to running such and such distance, then they're quite committed to doing that. So you kind of need to get into their brain a little bit. Runners love to run, and it's very, very difficult to stop them running. So another thing we tend to do is try to keep them running where possible, really. So Glenn can absolutely advise and give them some basic boundaries to say, I only want you to run 3 times a week, up to 20 minutes would be an example. But if it gets any more detailed than that, then that might be the time when he hands over to me to say, look, this runner is getting on okay with their injury. They seem to be okay with this minimum level of running, but they do want to, it's usually increase their distance to start with rather than their pace if they've become injured. Can you then take over they don't need to see me in clinic so much anymore? Can you then take over and start designing them a training program that's going to get them up to the next level without being injured again?
And I think this, I guess this kind of goes off the injury topic, but what do you find that people, what is the main reason that people will go to a running coach? Is it to get faster? Is it to, like you said there, to get longer? Like, not just talking about injured runners, but what's your experience with kind of like, why are people going? I mean, I obviously, as a physio, and I can see the absolute value in a coach, but what's the reason that most people come to you for running coaching?
Tends to be, so excluding injury, it tends to be when they've hit a bit of a barrier. So it might be time, or it's usually time or distance, to be honest, and they want to progress to what they consider to be the next step. It might be just someone going from a 5K to a 10K, or it might be someone at the real top end of things that's searching for a sub-3 marathon and they've done a 3:10 or something before. It may be to add a little bit of structure and motivation, although we have mentioned that runners are very motivated. Sometimes after many years of running, it is more difficult, and they're not sure what they're doing. They are repeating the same runs and running in this kind of grey zone where it's not really too hard, because that's difficult and they don't want to run that hard, but it's not really easy enough to gain any benefit either, and they're just running this sort of one pace all the time. So people would come to me for some different types of sessions, really, and runners also love to give feedback. So they love to do their run, and this might be true with any sports people, really, but they love to do their run and then tell you about it. And I get them to tell me as much as they like, from literally what they ate before, how they felt during, what roads they crossed, to how they felt the next day as well. So they absolutely love to tell you information. And okay, it takes a little bit of time to read, but it's interesting. You can pick up lots of things. You may also pick up potential risk for getting injured again, which is really important to try and nip that in the bud, because they'll probably say something like, I felt a niggle in my knee, but I think it's fine. I'm going to try that run tomorrow. And if I manage to intercept them in time, I can say, actually, could you rest tomorrow? Let me know if it's okay the next day, and then we can carry on like the following day at the weekend if you're feeling okay. Whereas if they were left them to their own devices, it's likely they'd just keep running until they needed to see Glenn.
Yeah, and I think you mentioned a couple of things there, which is really interesting. And I think the obvious thing that was coming to my mind as you were saying a few of those things is, what are the common things that people get wrong? You kind of mentioned that, like that grey zone running. You mentioned obviously not maybe listening to their body when they get niggles. So are there some common themes of like classic things that are holding people back performance-wise that you see commonly?
Yeah, it could be that. It could be just that they don't know how to progress. So they want to get faster, for instance, and getting faster is not just about running faster over the distance that you want to do. You know, you can do it in various ways. So you might want to build some strength at the gym, or you might want to do some hill running, for instance. The other thing is they usually have an event and they may not prepare specifically for that event, if that makes sense. So they may pick a hilly 10K, and what they're doing is running around the town on the flat very fast. And actually, when it comes to race day, they've got lots of hills and they have to run at different stride lengths and cadences. So I think things like that kind of prevent runners progressing. And it may just be lack of knowledge, lack of inspiration, that they're just not sure what to do to get better.
Yeah. And I think you mentioned consistency there being the king before. And obviously that's a huge thing, isn't it? Of just being consistent with getting the runs in. Because again, people want to get better, but if you don't put in the work, then you're not going to get there.
And they may say to me, I may look back at their past history, so the past 6 weeks, and 1 week they've run 5 times a week, brilliant, they put in 3 really quick sessions, but then the following week they only did 1 or 2, and it wasn't really brilliant. And I might say to them, actually, I'm just going to get you to run 3 times a week for 6 weeks. It might be more than that, and just see how you get on, because I want you to nail every single session. I want you to feel good about every single session as well, and hit the markers that I give you, and then we will start to see improvements.
And is there and again, this is, I'm sure it's going to be, there's very individual, obviously, this question, but generally speaking, if someone was to say to you, I want to get a bit better at running, like how many times do I need to run in order to do that? Is there a cutoff point where you would say, underneath this many runs a week, you're probably not going to make that many improvements? Or is it literally like that? Obviously it's case by case, but is there a kind of case of, okay, if you only train once a week running, you're probably not going to improve much? Or is even that going to be, enough to make you improve?
No, I think I'd see what they were doing currently. I mean, even we always talk about this 3 runs a week. It just works really well for the lowest amount of injury rate, really. So I always start with that. And if they're not doing 3 quality runs, not necessarily fast, but quality and structured, I would instantly start them on 3 runs a week. I wouldn't go up to 4 or 5. If I truly believe that they are doing 3 quality runs, so they might do a rep session, a tempo, and a long run for their distance that they're training for, I could start adding in a 4th run. So it might be a recovery run just to get them on their feet a bit more and to run in a bit of fatigue. But it's very rare that I actually see a runner that's doing those, that's not injured and that's doing those quality sessions. So there's quite a long way to go before we even start increasing their pace or their distance.
Okay, cool. And is there, with pace and distance, is there too much? Obviously we talk about going up too quickly, so is there any guidance you give people in terms of a general rule of thumb that might be, you might say, okay, try not to increase this much in terms of either speed or distance per week?
So distance, we seem to say, and Glenn can probably back me up on this, not more than 10% a week. Is that, Glenn, 10%?
Yeah, that's a very
Yeah.
established kind of mantra, isn't it, from coaches? And there is some evidence to suggest that going up above that does increase your injury rate. So I think that's something that the runners can also understand. Very easy for people to factor that into your programming, isn't it? There's some flexibility around that. Obviously, if someone's starting from 0, then going up 10% a week could take them a year to get up to, a decent distance. But yeah, I think once they're up to those 3 runs a week and they're going good, then that 10% rule works well for most, I would say. Yeah. So in terms of like pace and intensity as well, that's quite an interesting point, because that seems to be different with different pathologies as well. So some injuries will be more volume sensitive and some injuries will be more pace sensitive, so you might find that with some individuals you can progress their volume a little bit more steeply than 10%, but if you add in a rep session or an interval session, it will spike their pain immediately. So again, it's not just the volume as well. You have to look at the sensitivity of the pathology. So some are more aggravated by pace sessions, some are more aggravated by the longer, slower runs. So that comes again from getting to know your client. And Gemma's mentioned a lot of the stuff she monitors there, but the detail that she goes into with these guys is unbelievable, like in terms of knowing what they've eaten, knowing how much they've slept, knowing how they felt when they woke up in the morning. So if you have, as I mentioned at the start, a lot of runners are really passionate about their running, right? So and they want to go into that amount of depth. And I'm not a coach, I'm not, and that's just unrealistic. So that's why I think linking up with coaches is really, really good. And I always talk about having these 3 hats, as you work more and more with runners and you start to specialize in them more, and maybe you develop a service at your clinic that's specifically for them. You should have a good working knowledge of, as a therapist, as a strength and conditioning kind of trainer, and as a coach as well. So you're not expected to be a running coach, but you should be able to get them on the treadmill, should be able to analyze them, should be able to identify key markers that are associated with certain pathologies, give them some cues if necessary. And if you can't do those other 2 hats, then you need to have the links with people that can, so that you've got a overall system. Because you might have a clinic without a treadmill, in which case, you can't do the analysis. So you have to outsource that side of it, But I think if you're going to develop that service, you have to be able to cover those bases. And then you've got this kind of scale, haven't you? So average Joe who's running a London Marathon for British Heart Foundation or something, and is just going to do it once in his life and not ever do it again, might not need Gemma's input necessarily, but someone that's looking to, really analyze their data and to get better times, 100% going to need, some input from Gemma. So it depends on the injury, on the person as well,
Yeah, and you mentioned the strength and conditioning hat that you put on there as well. So I think it'd be quite good to go into maybe some exercises that people that you recommend that you think would be good. And again, we'll get maybe your input, Glenn, and then Gemma after this. And then I'd like to, maybe that segues quite nice into kind of drills for efficiency, which I'll definitely talk to Gemma about. But maybe if we start with you, Glenn, in terms of the strength side of things, what are you, from a physio rehab point of view, what are the big like lifts or the big things that you'd like to strengthen, and what the exercises that physios should be looking at incorporating into their running rehab?
So yeah, I mean, I'm a big advocate of this kind of 3-2-2. So 3 runs, 2 strength days, and 2 recovery days. So I think that's a nice kind of template for a lot of our injured runners. A lot of the lifts I give them are just basic, squats, lunges, Bulgarian split squats, that kind of exercise. But what's different is a lot of the runners would have been doing these. So a lot of the time they'll meet up in a park and they'll do circuit training together once or twice a week in their club, or they'll have gone onto YouTube and got some body weight exercises, but they won't have progressed them, So I give them set body weight criteria to hit, which is quite challenging for them usually. You've got an Achilles problem, for example, I'm going to be pushing you to do 1.2 times body weight on a lift in the gym. We call it a step riser exercise. So it's quite demanding. If you're doing a lunge, I'm going to get you up to 60% body weight on a lunge. So we're not training them to be strength athletes, but the strength improvements can come quite quickly, and also it shifts their focus a little bit. Because if you are limiting their running and they're feeling a bit down about it, we can work on the strength side of things. We can build that foundation. We can improve the, tissue capacity and stuff like that, tissue tolerance, and then we can increase the running around it. So a lot of the time in the gym, if they're still, the run might be a warm up for them. So they might do a 10-minute run in the gym. So they're still doing some running. So they're not, stopping completely. The drills that you're talking about, plyometric type stuff, we might do that as a warm up as well. So again, it's starting to introduce these parts of their program that are going to be key later on. And then their strength is there are general exercises, lower limb. I think, single leg exercises make sense as well because it's a single leg sport. But often I'll start them on double leg to get that base of strength and then work onto single. And then we'll be quite specific with those goals around the area that's sore. So if they've got a knee issue, then I'm going to want to make sure their quads are hitting a certain criteria, either with the handheld dynamometer or with exercises in the gym. Calf, I'm going to be focusing more on, Achilles, I'm going to be focusing more on calf for those criteria to hit. But yeah, it's nothing unusual, so the basic lifts, if you introduce that and load them progressively, you're going to get improvements very quickly.
Yeah, and I think the big thing there, although it doesn't seem rocket science to say like calf raises and split squats and things. I think a lot of physios will not load their patients enough, and they'll be scared to load them. And I think especially if you're getting someone to do a lift that's pain free, there's no reason not to load them and go into work into those 6 rep maxes, 8 rep maxes, those sorts of rep ranges where you are hitting, whether it's 1 times, 1.2 times body weight, whatever it might be for your criteria, because actually, a lot of the benefits I think from strength training comes from those, from really pushing that strength levels up. And I think when you're doing just body weight stuff, you're perhaps not hitting those same levels of tension through the tendons, through the soft tissues that you want to do to actually really, get that recovery rate through the tissues and to make it improve. So I think that's the big thing, that even though it sounds simple, it's not loading it enough, that I think a lot of patients or physios struggle with a little bit.
Yeah, I mean, I would add to that, there's a lot of misconceptions in that area as well, So the runners, when you first start them on that kind of path, they think they're going to bulk up and get really big and muscly and be too heavy and large to run, So there's a lot of misunderstanding there that it's not as easy as that, unfortunately. So
yeah, if only.
Yeah, they're not going to bulk up. So you're reassuring them on that side of things. The kind of intensity that you're asking them to work at, they won't be used to doing, so they'll have just been doing body weight circuits usually. So when you start loading them to a 6 or 8 rep max range, it feels dangerous to them, you know. So a lot of the time I'll go in the gym with them, and I'll essentially do a PT session with them where I'm taking them to that kind of intensity so they can get a feel of it, you know. And I always tie it back to their running. So I say, you know, what's your strength and conditioning been like for the last, you know, 2 years? A lot of them have been doing zero. The ones that have been training, they'll have just been doing body weight, and they won't have progressed it at all. So it'll be the same. You know, we do some lunges, we do some squats, we do some, you know, step ups or whatever. And I always use that same analogy back as like, okay, if you was teaching me to run, and we did a little, you know, 1200 meter loop around the block, and then you came back to me 2 years later and I was just still doing that 1200 meter loop around the block, would you think that would be appropriate, and would that be good progress, you know? And then it sort of clicks a little bit there, you know, that, okay, use the strength training the same way that you approach your strength training, the same way you approach your running. You know, you're trying to make improvements, aren't you? You're trying to progress. Do that with your strength training. And then obviously they're not trying to be strength athletes, but when they start getting back to their time where they perform, their performance is often better. You know, they feel better, and they can maintain it then once a week if need be, so they don't have to train as regular in the gym, but you can still maintain your strength once a week that you've worked on in the period up to that.
Yeah, and I think that again that leads on to something I wanted to talk about, which is more like to do with more drills and things around, you know, running itself. So obviously we've got the more generic strength stuff that Glenn's talked about there, Gemma. But what about things like running drills, specific kind of sport specific drills? Do you do a lot of that stuff? Is it something that you would advocate or not, or what do you think about that?
Yeah, so running drills, as we would call them, as opposed to any strength and conditioning exercises or training programs, are purely there really to increase or improve efficiency of a runner. So again, it would be the very top level of things we would do, and we would tick off a lot of things before we started doing drills. But drills very, very rarely ever injure someone or make them slower or fatigued. So anyone can start at any time, really. It just happens to be not something that we look at straight away. There are lots of different running drills. I think that pretty much all runners think that they're a waste of time when they first start to do them, because you don't get anything instant from them. You just look a bit silly doing your running drill, but they take a long time to sort of like reintroduce and retrain your brain to become a bit more efficient, and then you will see progress. But it's very difficult because you don't get that instant gain, probably even more difficult than the strength and conditioning stuff, which is hard enough as it is because they don't get instant gains from it either. So you really have to get into their mind or link with them. How is this going to improve their running? If you do this, how will it help? How will it increase your time or your pace or your distance? So always linking it back, rather than just saying, this is how you do the drill and I need you to do it 3 times a week. It is very likely they'll just bin it off. Very likely.
Do you are there specific drills? Are there kind of generic running drills that would benefit everyone, or is it very much an individual basis of like, okay, you need this specific drill and you need this specific drill, if that makes sense?
No, it's probably one of the things actually that anyone from a beginner all the way up to like an amateur athlete can probably incorporate all of the same drills. Now, some might need to focus on some drills more than others, but they can all certainly start them and do them in the same way. Some are a little bit more complex. If we're implementing different types of kind of skipping, that tends to be a running drill, or some there's like A skips and B skips, but everyone can do them and it would benefit all runners in the same way. You see lots of more track runners doing them and sprinters, but it would work all the way for endurance runners as well, because if they can be efficient over their full marathon distance, you know, they would potentially run it a lot faster using a lot less energy.
And is there a talking about efficiency, do you think, obviously there was a lot of chat in the last few years, and well, it's probably longer than the last few years. God, I'm getting old now. But when I read Born to Run about 10 years ago or something, and there was all this like, oh, barefoot running and run on your forefoot, and there was all this stuff. And then, as we know as physios, it doesn't really change the injury rate. It just kind of changes where you get injured, and you get more calf injuries if you run on forefoot. But is there a way you generally would say efficiency wise, that there is a best efficient way to run, or is it again going to be dependent on the individual? Or if someone came to you and said, I want to, run in the most efficient way possible, what would you say, or what would you, go down that route with them?
Your body tends to choose what it thinks is the most efficient way to run. Now, unfortunately, as we all know, that might not be the best for injury rate, and it also may not be the most efficient way. But on the flip side to that, it still might be the most efficient for you at that time. So if you try and change too much, your body's not used to it, and actually it'll probably become less efficient before it gets more efficient, and it's likely that you might get injured as well. So if you want to improve efficiency, which is important, it must be done really slowly, carefully, not changing too much. If you're, for instance, like you strike with your midfoot and you think, I'm going to get more efficient, I'm going to run on my forefoot straight away, it's very likely that you're going to be injured or certainly in some sort of pain, and therefore you won't be able to run, so you won't be efficient at all because you'll be doing nothing. So I wouldn't make with anybody under their own steam, or even under myself as a running coach, there is not any big dramatic changes I would make to anyone's running style unless they were considerably injured. But even then, the changes we make would be slow and we would be monitoring them. But I certainly wouldn't look to make big changes just to improve efficiency.
I think that's one of the reasons why we work together so well with Gemma, because some coaches will have like a recipe of a style that everyone has to try and replicate. And we're all different shapes, sizes, ages and stuff like that, injury history and stuff. So I think it's important that your coach is working with the person in front of them rather than a template of, everyone has to run like this.
And do you have, and this, I guess this maybe comes back to you, Glenn, do you have a time when you, and in fact to Gemma as well, but when is that time when you would make changes? Or are there times when any physios or coaches out there who treat and deal with runners, are there some key moments when you think to yourselves, actually this is a time when I do think I do need to change something, or change an element, maybe not a massive whole scale change, but more change an element of how they're doing things? Maybe if we start with you, Glenn, and then we'll come on to Gemma.
So whenever you start talking about running retraining, it's a kind of a bit of a can of worms in some regards, isn't it? Some people are very anti and just let people run how they naturally run. And the way I kind of process it is, if you look at elite runners, there's similarities in the way that they run, right? So they'll have a higher cadence on average. They'll have, good hip extension. They'll have good shoulder extension. You can have a kind of idea. The majority of elite runners will have similarities. You can always find an anomaly that runs differently that's at elite level. But if you took the 1,000 elite runners, you'd find a lot of similarities in the way they run. You can also look at injuries as well, and you can see that there does seem to be some running mechanics that lend themselves more towards certain injuries. So a strong overstriding pattern is one. A increased hip adduction is another. So there are certain patterns that seem to have a higher link with injury as well. So it's not that we can kind of completely dismiss it. So in my mind, if somebody's running in a way that has got some link with their injury, then we could explore tinkering with their, retraining and give them some cues to address that. So I think the perfect example, we mentioned knee pain. So knee pain makes up around over 40% of running injuries that you see. And knee pain, there are links there with overstriding and slow cadence, for example. So if you get a runner in with knee pain, their volume's pretty good. They've only been running 2-3 times a week. They've been running for a little while. They're doing some strength and conditioning. They've got good recovery, and then you get them on the treadmill and their cadence is particularly low, and they've got a really heavy heel strike. Then for me, it's a natural progression to explore that. Try the cadence, increase the cadence, try and change the landing pattern a little bit. Not necessarily try and make them a forefoot runner or a midfoot runner, but just work on those aspects, and you could expect to see some improvement from that, I would argue, you know.
Yeah, and I think what's interesting about that is that you mentioned cues there quite a lot, and I think one of the things that I tend to do with runners is kind of work more on those external cues and more on cueing them, and then let the chips fall where they will. So it's kind of like, yeah, if you increase the cadence, often you probably will, or potentially you will get a bit more in midfoot or forefoot striking rather than heel striking, because of the natural way that increasing the cadence will do it. But it's not because you're telling them to run on their forefoot; they're just doing it naturally. So you're kind of still allowing that their body to find out what they want to do, but you're just doing that through cueing them to just take more steps, basically, which I think it also gets people thinking less analytically and more just kind of like, I just take more steps, and just it's more simple for people to understand. And I think that's where the running retraining, it's less, from what I've read and from what I've looked into. I think I'm a more of a fan of less prescriptive, like run like this, and more cues to do things like you said there, relative to what their running style is, and let them do what they naturally want to do.
Yeah, I think you always have to be able to relate it to their condition. Yeah, and normally that's from start to finish. So you've taken your subjective, you've watched them move, you've done your other tests, and then you've got them on the treadmill, and it should be a nice kind of flow from start to finish to justify any changes that you do make, you know. And yeah, external cues definitely more powerful, more effective, quicker success rate with those than trying to give too many internal cues. And I think we mentioned about so touching back on the big hitters, really, when you're dealing with a runner in terms of volume and previous injury and rest days and stuff like that. There's some big hitters with running retraining as well. And I think that people always want to try and overcomplicate things, particularly physios, you know. So if you've got someone on the treadmill and you're trying to talk about their rib rotations or their pelvic position or something like that, you know, and you're missing out, you haven't even measured their cadence, you know, for example, then you're overcomplicating it there, you know. So there's a few key cues for each condition, for each pattern that you see. And this is what we do on our training course. We kind of break down the different patterns and the simple one or two, maximum two, normally only one cue that you might give them, ideally external cue, like you said, and keep it simple. I think I really couldn't emphasize that enough. You have to keep it simple. And even when you keep it simple, as Gemma mentioned, their running economy is going to go down. You know, if they're concentrating on anything other than just running normally, their running economy is going to go down for a period of time, you know, and it's going to be more effort. So you have to be mindful of that every time you cue someone. Even if you just tell them to concentrate on their breathing, their running economy is going to go down. So if you're giving them any kind of cue, it's going to have that effect as well. So you have to factor that in, which is why any retraining cues that you do give, it's really nice to do it when you are in that rehab process, because normally they're doing a graded return and they're running a bit less. So you can't just send someone out on a 15K run with a metronome beeping in their ear, because it will drive them insane, you know. So it's so you have to, I think that's a real key message, is don't overcomplicate it, keep it simple, pick one or two things that you think might have maximum impact, and incorporate them in a graded way.
Yeah, and you mentioned the kind of rehab process. I think that gets me onto my next kind of topic, which is more the end stage sort of rehab and then performance stuff. So in terms of a weekly schedule, so say you've got someone, and perhaps we'll come to Gemma for this one. So if we're thinking about a schedule of running, with regards to kind of like strength and conditioning versus running, and how many times should you do, like if someone wants a good schedule or a good setup for workouts for running, how would you think about that? And are there some specific numbers of sessions you do, or how many strength and conditioning, how many running, etc.?
Yeah, so let's imagine they have previously been injured, but now they're kind of discharged from Glen, as it were.
Yep.
I can see their notes, I can see what their injury is, and I know if there were any measures taken to sort of improve that, whether it's running, retraining, or strength and conditioning. I would probably start them still with this 3 times a week, unless they were a really advanced runner. It doesn't mean quick, it just means they've been running for a long time. So they may always have 1 to 2 rest days. And I do mean complete rest days, not just an easy run. I have a look at their other load as well, because sometimes, although they say they're having a rest day, they've gone to the gym and done a spin class, or they've walked the dog for 5 miles or something like this. So I really have to say, what did you actually do on that day? So we look at that, and 1 complete rest day, 2 if possible. 3 runs a week. One of them will be a rep session specific to the distance that they are trying to train for. So they might be training for a 5K, they might be training for a marathon, but a rep session tends to be a set distance of repeated set distance with some rest in between. Sometimes the rest is taken sort of actively. They would do a tempo run, which I would push them past that grey zone. So not so hard that they can't complete the run, but a run of distance that's probably a little bit less than they're training for, but a bit pacier, faster really. And then 1 just really easy run. So that's probably the hardest thing for runners, to make them run really easy, because they think, I'm not getting any benefit, I'm not doing it. But I tell them to go as slow as they possibly can. I say they should be able to talk to their friend if they're running with someone else. They should be able to sing a song out loud. And they say, oh, really, that slow? And I said, doesn't matter. You're not on race day at the moment. I just want you to spend time on your feet, an easier run, just build in that big aerobic base as well. And then I would send them to the gym if they had the facility to do that twice a week for their strength and conditioning, which usually would be quite simple for me, because the exercises would have come from Glenn. So that's great. I can keep an eye on them. I can build them up if I need to and progress them. And I would possibly put in 1 run or just a note to mention the retraining. So if we did give them some cadence retraining, I'd be able to keep an eye on them. And if I felt it was going downhill again, I could just stick in a really easy run for them and say, this one, I just want you to practice getting your cadence back up again, just to remember what it's like. So that would be a sort of a typical week for someone who was training for an event, for instance.
Yeah, cool. And then the easy run, what sort of distance would you do the easy run at? Would you go longer but really slow, or?
Yeah, further or longer than your race distance, apart from marathon, which obviously you're building up to, and you're not going to do more than 26 miles. But if you were running a 10K, you obviously want to run that at pace. I would if you're an advanced runner, I'd probably get you running up to maybe 14, 15K, but very, very slowly, lots of time on your feet, so that when you come to drop back down to that 10K and at pace, you're more than used to doing the distance and spending the time. If you just keep running 10K quickly over and over again and then expect to do it quicker on race day, it's very unlikely it's going to happen. So you need the mixture of runs.
Is there a maximum with that one in terms of like how much more percentage wise than your long? So say it was a 10K, for example, would there be a maximum that you would do over on a slow run, or not really?
Haven't got a specific. It does depend on the athlete. I said 15K for a 10K, but you'd probably have to be fairly advanced to do that. If it was someone who had done a 10K before but wasn't really advanced, I'd probably just send them to 12K. That would be enough for their slow. Because also remember, they're running it slower. So even though they're only doing 1 to 2K over, they're spending a lot more time on their feet.
Yeah. And then you mentioned the rep run as well, before. Would that be like repeated? So say, for example, we took a 5K in this example. Would that be doing like repeated shorter distances with rest in between at a faster pace, or race pace, or how would you?
It would depend. I'd probably get them doing shorter distances to start with at faster than their race pace, because they're probably able to do that, but they're not able to sustain it over their 5K. And then I might progress them to doing something like a cruise interval, so 4 times 1K at race pace, or probably slightly faster actually, but with only a jog recovery in between, so they're not getting a lot of rest and they're stringing those Ks together until they can get to 5K, hopefully quicker than they did before.
Yeah. Okay. Awesome. It's just good for my running.
Your secret training.
Yeah, exactly. My secret training we talked about earlier. Cool.
One of the barriers we face actually is quite a lot of people, not only do they have Strava, but they also have very fancy watches. And your fancy watch tells you lots of information, which I'm sure is incredibly useful. And I look at it as a coach, but sometimes it's not so useful. So I went on my run this evening, actually, and it told me what I should be doing. Whether I should do it or not, I'm not sure. But anyway, it told me I should do this slow run. So that's probably okay. I ignored it, obviously. I'm a runner. But when I got back, it told me I was unproductive. So even though it might have been in my schedule and I may be committed to it, I might have even had a good run. Sometimes the watch and the feedback you get from these things it's very it means a lot to the runners, and sometimes it is correct. I'm not saying it's not, but sometimes they need a third person to come in and just say to them, actually, this was a good run. The pace here was this much, it was good. Maybe you did push a bit hard, so let's just pop in a rest day tomorrow and then we'll push the next session out. But as soon as they look at their watch and see their VO2 max has gone down or something and they're unproductive, they just think the whole program is disastrous and that's it, they're never going to get better again. So as a coach and possibly as a physio, I don't know if Glenn's faced this yet, we do come up with challenges with technology.
Well, it's a really interesting point, actually, in terms of technology. So last couple of things I wanted to go through, so I've taken up a great chunk of your evening. So thank you both for doing it. But in terms of technology, are there some like good pieces of tech that you do advise, or that you would say that are really useful for runners, or Glenn, in your case, for physios assessing runners?
I think, first and foremost, you need to be comfortable. So not necessarily tech-based, but if you are not comfortable when you go out for a run, it's very unlikely you'll want to go for a run to start with. And in different weather conditions, for instance, and you might not be able to increase your pace or distance because you're just not comfortable. So as simple as the clothing you're wearing, I would look at that to start with. Very important on race day as well, actually. Including your trainers as well. Now there's a whole another subject about shoe recommendations, but one of the aspects is comfort. So if you are uncomfortable in your shoes, you would either speak to Glenn or myself and we'd talk to you about that. Then you can come on to tech. You can either carry your mobile with you, which is safe. It's a good thing to do, actually. And there's plenty of run programs on there that you can track your run. So Map My Run, Strava, etc. Or just a basic Garmin watch that tells you your pace. It's really interesting. The time it took you. Some of them tell you cadence now, which is useful, but we can still measure that without the watch at the running clinic. But a basic watch would be enough just to start the runner off, and then they give you and heart rate is quite good to measure as well. It can be very variable, but it is helpful for me as a coach. Maybe not so much when you start running, but as a coach I would still incorporate that into what I'm looking at. And sorry, Glenn, you were going to probably say something.
I was going to say, in terms of the clinic, I think there's you can get some really expensive kit, you can get some really expensive gadgets, but I think to do a decent assessment that you can replicate, we'll use our iPad, and then we'll have huddle technique on the iPad. In the Hemel running clinic, we've got a TV screen up on the wall, so we're getting a little bit more fancy. We've got Apple TV that links up to there, so they can see themselves in real time as well if we want to add that. So that can be quite useful for if you're putting the view from the rear and they're looking at what we call the knee window. So if they're coming into increased hip adduction, they can retrain that whilst watching it in real time. So but I'd say that's not essential. That's kind of added. But if you've got a tripod, an iPad, huddle technique, and a treadmill, then you can do a good running assessment from that, and you can replicate it. You need to have space as well, obviously, to film around it. But if you haven't got the space and you haven't got a treadmill, then I link up with local gyms, and I can go into the gyms with them, and I've got permission to do that as well, so I can film them on the treadmills in the gym. There's an argument about treadmill analysis if they're running out on the road all the time, but you can control so many variables. It's really useful, and from my experience, it doesn't take that long for people to become familiarized with the treadmill. So if they're telling you, oh, this is weird, and there's no point filming them then, because you're not getting a snapshot of their normal technique. But most runners, 5 minutes, 10 minutes on the treadmill, they're fairly familiar with it. They're fairly comfortable with it. If you're really keen, you can go out with them and try and film them on the road. But I think in terms of replicating the same thing over and over again, the treadmill and the tripod and the iPad is the basic requirement, really.
Cool. And then I was going to let you go, but then Gemma's brought something to my mind that I think it's too juicy not to talk about. So trainers, I want to talk about trainers. So it's because do you know what? It's such a common thing that people will be like, oh, what's the best trainer? Like, what trainer should I buy? Are there some general guidelines for people? What would you, if someone came to you and just said, Gemma, what trainer should I buy? Are there certain questions you want them to be asking them? And then are there different brands that, and again, you don't have to go into necessarily the specific brands if you don't want to, but by all means do as well. So what are your thoughts on trainers?
It's actually not too difficult because the number one factor for trainers is comfort. So if they are comfortable, then it is likely that they are at that time the right shoe for you. Now, obviously, if you're an injured runner, a little bit different. It still might be the right shoe for you, and then there might be other factors going on. Some runners come to us injured because they have changed their shoe. So there's often a lot of quick messages between Glenn and myself where Glenn says, Gemma, I've got this runner and he's got a pair of Nike shoes. Can you tell me the difference between these and the shoes he had before? And being a bit of a training geek, I can tell him the exact difference between them and where possibly this runner's fallen into a bit of a trap and got injured. Usually it's to do with the heel toe drop. So they might buy a pair of racing trainers, racing running shoes, which tend to have a lower heel toe drop. They go out on a long run in them and suddenly they come back with Achilles pain, possibly. It tends to be things like that. So if we've done everything that we can do with their running retraining and their strength and conditioning, we would still always ask them what trainers they've got, and I would just keep that kind of in the back of my mind. If they've got a knee injury and they've got quite a large heel toe drop, I may consider dropping it down, but it would not be the first thing that I change.
And Glenn, what about yourself? Did you have any like preferences or not really?
Yeah, so comfort again, key. I will give you an example with myself. N equals 1. Yeah, so when I was coming back from my ACL, I was hitting a bit of a sticking point with my runs. So I was hitting about 10 minutes, and I was having to stop with pain, and my strength was decent, the rest of it. And like I say, trainers are not as important as volume and recovery days and strength and conditioning. But for me, I changed my trainers from a 12 mil heel drop down to a 6 mil, which is quite a drastic change, which I wouldn't actually recommend for my clients. But I used a specific trainer that also had quite a large shock absorbency to it, and within one run, my pain went from coming on at around 8-9 minutes, and I did one run all the way through to 20 minutes pain-free just from changing that heel toe drop for me. So again, not what I would recommend for my clients, but just an anecdote as a kind of N equals 1 that I saw the benefit of tinkering with heel drops there on trainers for knee pain in particular.
So this could be a difficult question to answer, but if you wouldn't advise it for your patients, why did you do it yourself?
Yeah, well,
did I advise that, Glenn?
No, I did it.
Worryingly,
I did it myself. There's a lot of things I do.
I wouldn't have advised it.
I wouldn't advise to my patients. But
it is worth asking your patients. So straight up, they may come in their running shoes, especially if they're having a running assessment. So it's worth just glancing down at their trainers. If you don't know what they are, they will know. So you can ask, how long have you had them? And it's not necessarily about the length of time. If they probably won't know this, but how many miles have you run in them? Because it soon comes around, especially with marathon runners. Trainers may last for a medium-sized athlete, maybe 200, 300 miles. And that soon racks up, especially during marathon training. So we would make sure that actually the trainers aren't too old, because they'll lose some of their cushioning, some of the benefits they may have had that were fine to start out with. And if they were getting on okay with the trainers and we can't see any other reason, it's likely they do need a new pair. So we would probably advise them just to get the same pair again, because it's the safest thing to do. Another important factor is rotation of shoes. So if you are a keen runner and you're willing to buy trainers anyway, we get our runners to rotate their shoes around a little bit. So nothing too dramatic, not like Glenn's example, but they might do some of their shorter runs in their race trainers. So maybe a 5K in their race trainers, but I would always make sure then they go back to another pair of trainers for their longer run. And that just gives them just some different things, some different ways to run, really. And if they're not injured and they're doing okay.
Cool.
Yeah, I feel like expanding on my example.
Trying to dig yourself out of a hole.
Trying to dig myself out there. The reason I wouldn't have, I think it's important to explain why I wouldn't have recommended that to a client, right? So I think that's too big of a drop going from 12 to 6. And it's too big of a jump to go from 10 to 20. So it's like too steep a progression. Yeah. So I think rather than, it's good to point out why I would have done that differently. So if you're going to change someone's heel drop, it's best to do it in a more graded way. So you're not doing it so drastically. And then obviously if someone's hitting pain at 10 minutes, we wouldn't tell them to just carry on and do double. But you know what it's like. You've had an ACL when you first start running. Bit of euphoria, feel like you're on your comeback. So yeah, it was a positive memory for me. But yeah, in hindsight, that's one of the issues when you deal with your own rehab, isn't it? Is when you look back on it and you reflect and you think, actually, if I was overseeing this care, I'd have done it slightly different. And I was very lucky, actually. I was teaching a hip course over in Belgium, I think, and Bart Dingennen was on the course, and every break I was just picking his brain about my ACL recovery, because he's obviously an expert there. And he oversaw that, and obviously I was phoning you on occasion, wasn't I, getting your input as someone that's been down that road before. But yeah, it's hard to manage your own recovery, isn't it, as a therapist? It's not easy.
Well, I think they always talk about coaches need coaches. Like you just because you know what you do for someone else doesn't mean that you always would listen to your own advice. And it's sometimes quite nice. Like I remember when I was doing personal training, I remember it's still quite nice just being told what to do and just doing it rather than having to. Sometimes you can obsess too much about your own training, like you want to change stuff all the time because almost in a weird way you kind of know too much in a way where actually sometimes you just need to get your head down and just do a program for 6 weeks, 8 weeks, whatever it might be, which I think again is often the reason why having a coach, a running coach, a whatever coach, a PT is so useful, because you just get told what to do and you just stick to that. And often when you actually stick to a process and you stick to a structured program, you will make results and you will improve. But when you're trying to do your own, you kind of second guess yourself, I think, sometimes.
Yeah, I have my own PT and sort of doubles up as a coach a little bit. So though I set my own training schedule, I do have someone, particularly for my strength and conditioning, that just tells me what to do. And I absolutely love it because I don't have to think about anything. It's brilliant.
I think it's about accountability as well, isn't it?
Yes.
Totally, yeah.
The information's all out there. So like there's so much information on what would be a diet or a strength and conditioning program in the gym, but you definitely see people get better results when they're checking in with a coach regular and they're more accountable, aren't they? So it holds you to their standard a little bit more. You're going to get checked. It gives you a bit more motivation.
Well, Gemma said it earlier. The king is consistency, and what that accountability does, it makes you consistent. It makes you do the work and put the sessions in, and ultimately that's what gets majority of the results. So that I think that's again going back to that. I think within rehab with anything, the patients I have that do their exercises and do it consistently, most of them improve. Obviously don't have 100% success rate, but the ones that don't do their rehab are never going to get better, or they're certainly they're rarely going to get better at the rate that the others do. So I think like Gemma said earlier, consistency is huge. But anyway, I've taken up way too much of your time on a weekdays, but thank you so much, both of you, for doing it. I think that's been so interesting, and I think lots of gems of information for runners out there and for physios as well who are looking to treat runners. So I think final thing, I guess, would be if people want to get in touch, if they want to look into your resources or look into coaching, Gemma, with yourself, like, have you got any resources, or have you got any social media or things like that people can get in touch? If we go for you, Gemma, first.
Oh, sorry. Yeah, so the best way to get in touch with me actually is through the Physio Academy website. There is a link, hopefully, there to my email, which is the way most people get in touch. Yeah.
And we'll make sure I'll put links on the descriptions of the podcast and the show notes, and on YouTube we'll put links on there as well. So yeah, there'll be links to those things. So if people want to check out your stuff, they can do that. And what about you, Glenn?
Yeah, so Instagram, Twitter. Instagram, I'm Physio Academy. Twitter, Hemel Physio. So that's probably the best way to get in touch there as well.